Welcome to a day that showcased Dr. Paul Farmer, a global humanitarian, physician, and medical anthropologist. The American Society for Clinical Pathology and the World Association of Societies of Pathology and Laboratory Medicine have combined their scientific resources, enhancing the education, international scope, and leadership for the entire laboratory team. On October 20th, Dr. Paul Farmer delivered the scientific address. The co-founder of Partners in Health and his colleagues focus on community-based strategies to treat patients in resource-limited countries. His unique perspective set the stage during an unprecedented annual meeting. Let's start our remarkable journey. ASCP President Dr. John Tomaszewski's presentation discusses how ASCP's identity is evolving in strategically determined directions. Professor Dr. Michael Ulrich turns over the WASPOM presidency to Professor Dr. Gumze Mozon Kuse. Sessions explore leading-edge science for pathologists, pathology residents, and laboratory professionals. In the exhibit hall, attendees visit Science Connection Central, participate in the Hands on the Future Learning Lab, and exchange ideas at the specific hubs for pathologists, residents, and laboratory professionals. Led by an international panel of experts and a cervical cancer survivor, tomorrow centers on global access to healthcare for cervical cancer screening and treatment.
The reason why the organization's annual meeting this year is so pivotal is due to the fact that for the first time, we are an inclusive organization for the entire world. We're doing this in tandem with WASPOM, which is the World Association of Pathology and Laboratory Medicine. So we're the big tent for pathology and laboratory medicine, and it allows multiple kinds of activities to occur. Advocacy efforts, educational efforts, credentialing types of efforts. So we're seeing a huge multitude of individuals. There's about 2,300 people here, and an opportunity to work with folks we haven't necessarily networked before. And there's a great future for the field of pathology and laboratory medicine, because finally many pieces of the partners who are working together are seeing the connectivity between the parts internationally as well as domestically in order to leverage what we know in the United States to bring that kind of education to the world.
Having a fellowship is a necessity that's brought upon by the marketplace. Having trained 20 years worth of residents, only 3 have gone into a job without fellowship training. Currently, the best source of information is that job survey that's taken by 100% of the trainees in Canada and United States.
Well, medical technology and the other careers in laboratory medicine allow you to take your love of science, biology, and chemistry and apply it in a way that helps people. And I think that's the reason so many people choose it as a career.
If you're involved with residents and you care about them and you respect them as fellow professionals, then involvement in a tool that helps to assess them means that you want it to be the best possible tool. So I think the involvement with residents made me want to make the RISE, when I got involved with it, the best that it could be. And the key that I found was the people. If you could find like-minded people who were involved with residents and had that same feeling about putting out the best possible product, you couldn't stop them.
The RISE, as you know, has been around for almost 30 years. And it was developed originally as a paper type exam with slides and Kodachromes and things like that. Barbara McKenna was instrumental in taking the RISE into the modern age. The success of the RISE is predicated on 2 things. One is our volunteers are all experts in their areas. So the types of questions and the breadth of questions that we have for the RISE really do encompass what residents learn and what they need to learn during their training. That, I think, is the key to the success.
The ASCP Member Lifetime Achievement Award is especially meaningful to me because it's the most significant professional honor that I have received during the course of my entire 42-year career.
Laboratorians need to be recognized as professionals and as part of a healthcare delivery team. Healthcare, of course, in any context, whether in the U.S. or anywhere in the world, is a multifactorial process that involves many, many professions, many, many people, many contributions. Laboratory is just part of that, but it's a very important part. And that's why I think it's important for us to maintain advocacy on behalf of laboratory professionals so that they're recognized for what they do.
One of the most satisfying things about using everyday people to spread information is that you can touch a lot of people effectively. And if you use their skills and their passions, it can instigate change in a way that otherwise wouldn't be obtainable. I'm very lucky because I get to use just what I'm passionate about to reach out to my community and let them know more about the laboratory professions.
Microbiology, I think, is on the cusp of being very different in the near future. Just like when computers came about, I remember in high school they were having computer classes showing us how to turn the internet on. And now we've come so far, and I feel like microbiology is the same way. We're getting into a molecular biology time frame.
Of course, I'm going to attend Boston. By the grace of God, if I'm alive, I'll be in Boston. I'm from New York. It's not too far away from New York. And then Boston is a nice place. The hotel where they're going to have the convention is very big, very good, has a lot of space, and it has a lot of conference rooms for the activities. So anybody that is going to attend Boston is going to have almost the same experience as we're having here today.